My name is Erin Reifeis, and I am a graduate student at Clemson University, and I'm going to go over labeling the bones of the hand. So to start, we have the bones of the lower arm coming into the wrist here. On this side, you have the radius, and on this side, you have the ulna. And a good way to differentiate between these two bones is you see the thumb here as it's shorter than the other fingers, and your radius is on your thumb side, the thumb is rad, and your ulna is on your pinky side. And again, when you're going to shake someone's hand, your ulna is underneath. So that's a good way to differentiate those two bones. Moving into the wrist here, also known as the carpals, we'll have 8 smaller bones that make up the wrist area. And a good way to remember that these are called the carpals is that you use your hand to drive a car. So these are your carpals. Moving up to make the palm of the hand, we will have our metacarpals. And that's or these bones here. And then above that, to make up the fingers, we have our phalanges. And fingers, phalanges, that sounds similar, so that's an easier way to remember that. And within the phalanges, we have the distal, the middle, and the proximal. And again, those 3 make up your phalanges. So we have the phalanges, we have the middle, the metacarpals, and then we have these smaller bones, which are the carpals. So within these smaller bones, as you can kind of see outlined, there's 2 rows. Not easily seen, but they're there. And a way to differentiate between the 2 rows, we'll have a distal row and a proximal row. Now our distal row is actually touching a metacarpal. So if you can kind of see that in the video, these 4 are touching a metacarpal, so that's your distal, while these 4 down here do not touch the metacarpal, so that's your proximal row. So starting within the proximal row, the largest bone here is where I'm going to start with a mnemonic, move around clockwise, and end back on the upper bone here. So starting with your thumb, this largest bone here touching the radius will be so long to pinky. Here comes the thumb. We end with the thumb, midway with the pinky finger. Okay, so long to pinky. Here comes the thumb. So starting again at this largest bone here in the proximal row is going to be your scaphoid bone, followed by the lunate, the tricutral, and then the pisiform. Moving into our distal row, we'll start with the hamate, capitate, trapezoid, and trapezium. And then visually here, scaphoid, lunate, tricutral, pisiform, hamate, capitate, trapezoid, trapezium. So long to pinky, here comes the thumb. These are the bones of the hand. So the next thing I'm going to do is identify the different bones of the arm and the shoulder. So starting in the lower arm, you have the radius and the ulna. And the way to differentiate between these 2 bones is that your ulna is underneath is the lower arm when you go to shake someone's hand. So you think of your normal shaking hand process, the ulna is under. And then the radius is up above. The radius matches up on the thumb side, and a good way to remember that is you give someone a thumbs up. That's good, that's rad, that's cool. Radius, thumb is rad. Moving to the elbow, on each of the sides of the elbow here, you have your epicondyle, you have your medial epicondyle, and your lateral epicondyle. And those are always good when you're doing assessment to palpate for tenderness or swelling. If there is any of that noted by your patient, that would be for assessment of golfer or tennis elbow. And then moving to the upper arm, you have your humerus bone, which will then connect up into your shoulder. Your shoulder is brought together by your clavicle bone, which is the bone that moves from the suprasternal notch across, connects with the scapula, which is your backbone, and a good way to remember that is scap, sounds like back, so scapula, backbone. And those two bones come to meet at your acromion process, which when you palpate your clavicle all the way to the lateral side, you'll feel it. It's kind of like a little point, a little notch, and that's your acromion process. And then the actual joint of where those come together, if you move your fingers just medial, you'll feel a little bit of a gap space there, and that's your acromion clavicular joint. So that's where that kind of comes together. So your clavicle, scapula, acromion process, which is that notch right at the end there, and then your acromion clavicular joint, or the AC joint is also known that. And then one more area to note within the shoulder is the scapula that hooks into the humerus bone to make your shoulder joint, that ball and socket joint. There's the glenoid cavity, which is where it sits. So the glenohumeral joint is the meeting of the scapula and the humerus bone. We're now going to move down and label the bones of the foot. As you can see outlined here, laid out differently than the bones within the wrist. And one major difference you can note is that there's only 7 smaller bones versus the 8 as we saw in the wrist. So to start, we'll label these smaller bones, and these are all going to be the tarsals, different from the carpals that we saw in the hands, toes, tarsals, a little bit easier way to differentiate those. And so then moving up into this middle region, we have our metatarsals, as we can see here. And then above those, we again have our phalanges. And within that, we have our distal, our middle, and our proximal phalanges. So phalanges, metatarsals, tarsals, toes, tarsals. So then getting into labeling these smaller bones of the foot, we'll start with this large one that forms back into the heel, and that is your calcaneus. Calcaneus. And a way to remember that is you get calluses usually on that part, on your heel. So calcaneus, calluses. The next one is this large bone here that'll actually extend up to articulate with the bones of the lower leg. And this is your talus. So that is your bigger one. It's tall. It is a talus. It sticks up. Moving up, it's not as easy to make 2 rows like we did with the wrist, but again, you do have a distal row that will actually extend and touch the metatarsals, the same way I tried to explain with the wrist. So we have a distal row and then somewhat of a proximal row back here. So this bone here, some people have said kind of looks like a boat. I don't really see it, but it in a way navigates these 3 bones to touch the metatarsals. So for that reason, I'm going to name this one the navicular, and it's going to navigate us with these 3 smaller bones that are the cuneiform bones. The 3 of these are named the same, so to differentiate between the 3 of those, we have the medial cuneiform, and then we have the intermediate cuneiform, and then the lateral cuneiform. Again, it's cuneiform. And then this guy in the middle is your intermediate. So medial, intermediate, lateral, cuneiform, those 3 smaller bones. And then the last one is this guy that kind of sits off to the side. Another way, some people have said it looks somewhat like a cube. Again, it's a little bit hard to see, but hey, we'll use it because that is your cuboid bone. And that's that guy right there. So again, with the bones of the smaller foot, we have our calcaneus, which you get calluses on your heel. You have your talus, which is the taller bone. You have your navicular, which is going to navigate these three smaller guys, which are your cuneiform bones. We have our medial, our intermediate, and then our lateral cuneiform, and then we have our cuboid form out here. Next, I'm going to identify the bones of the lower extremity. So we're going to start with the lower leg, which consists of the tibia and the fibula. And a good way to remember the difference between those is the fibula is the smaller bone on the outside. You tell a small fib. So you tell a small lie, that's your smaller bone to the outside. And your tibia is the large bone in the front, also known as your shin bone. Moving up to your knee, you have a medial condyle, which you can palpate. You can kind of feel the same way you felt in the elbow. And then you have a lateral epicondyle. Again, in the same way that those framed the elbow, these will frame the knee. A good place to palpate when you're doing assessment for patients, noting for any pain or swelling or tenderness. Moving up the leg, I'll have you stand up. You have the greater trochanter, which is the head of the femur, and it's not the hip bone, so that's not what you're feeling. It's lower down than that, and it's sometimes easier to palpate if you have your patient laying on their side. So in our last skeletal examination, we're going to look at the ribs and labeling them by number. Most people have 12, although there are some people that have 14. It is normal. So when numbering them, you start with 1 being most proximal to the head, to the skull, and 12 will be most distal from the head to the skull. So like I said, start with 1 and then simply move down, labeling all the way through to 12 or to 14 if you have more.